Hi, I'm Kitty Loprecht and I'm your physiotherapist. So you are going to have a neck operation or something that we call ACDF. Now, ACDF stands for Anterior Cervical Disc Fusion. Anterior means in front, so it just means that we are approaching it from the front, and cervical is your neck. Disc is the intervertebral disc in between the vertebrae, and then fusion is to make something stiff. So before we go into why, and I know that this has been explained to you by Dr. Lambrecht, so I just want to talk to you about your back. And just remember that your neck is part of your back, and it is really one structure that starts at the base of your skull and goes onto your coccyx. And in between each vertebrae, we have this intervertebral disc. Now, it's important to understand that the movement takes place over two columns in your back. And the front column is where the disc is. The disc looks like a balloon with jelly in it. So it's got an encasing, which is a ligament, and then there is a soft gel type structure inside. What is important to understand is that because you've got a soft center, the disc has pressure, like you have blood pressure. And it basically does what blood pressure does, is that if we push up our blood pressure, and we can have a stroke. So the little artery, the side of the artery deteriorates with the increase of pressure, and then some of the blood can come out, and that is basically a stroke. Your intervertebral disc, same thing can happen. So over time, with the continuous increase in pressure, and that pressure has got something to do with position, the ligament layer can deteriorate, and some of that gel can come out. It's also important to understand not only is that disc like a shock absorber, but it also keeps space. So, and especially in the neck, space is quite important because if the vertebrae come closer together, the canal wherein the nerve runs is then too small. So, and thirdly, and I think this is the function that very few people really know, is that it gives nutrition to the cartilage of the vertebrae. So it feeds the vertebrae's cartilage, and as that gel center deteriorates, so can the cartilage. This again has an influence on the little facet joints at the back. And it increases their normal wear and tear and makes it quicker. So in your case, and especially if we're going to do an ACDF, it means that it is the intervertebral disc that is giving us problems. So what Dr. Lamprecht is going to do is going to go from the front, and he's going to make a small incision, and then he's going to take the disc out. The space is then going to be kept by a spacer, and this is not an artificial disc. An artificial disc is something totally different. It is something that mimics the normal disc's function. The spacer that is going to be put in keeps space, and it will help to form a fusion. So on the front part, on that level, there will be no more movement. The artificial disc is not something that we do very often. Their success rate is not very high. So although with the ACDF, the success rate is quite good, well, very good. And therefore, we have some international rugby players that can still play professional rugby with these in their neck. So, yeah, they are quite stable and they do quite well. The advantage of this is the fact that the facet joints at the back still has movement, and that then protects the other levels of the discs. So when the spacer is put in, it's filled with artificial bone, and then over time, in the next 6 weeks to 3 months, the bone will grow through from the one vertebrae body to the other, and therefore you then have a fusion. So it's important to understand that the fusion is not there at the beginning, but it's being formed over time. And that will be within the next 6 weeks to 3 months. It's also important that due to the fact that the fusion must be formed, part of our program has certain stipulations that we don't want you to do, that we will go in detail through with you when we do your home program. But part of the things that might limit those bone growth, for instance, is smoking, and also some anti-inflammatories. But that is something that we will talk about later again. So the other thing is, so in the end, you will have what we call a partial fusion. So it is because only one column of the two are fused. Okay, so it's not a total fusion. So let's talk about what happens just after the operation, and I think this is the most important thing. So when you wake up, most patients, and you know, in many years, I think that's the first reaction, is that people will say, my arm is better, which is wonderful. And so that's the first thing that people are aware of. The second thing that they're aware of is that swallowing is quite sore. The reason being is that to help you breathe while they're doing the operation, a tube is passed through your vocal cords, and then everything must be pushed aside to get access to the vertebrae. So, and therefore the vocal cords are sometimes swollen and quite sore. The first thing, when you wake up and you are more awake, the thing that will help is ice blocks, and not cold water, but ice blocks. So immediately ask them or the nursing staff to give you some ice blocks. It's quite important, and I've, through experience and through many patients, will tell you that that is really the thing that made a big difference. So the sooner you can go and suck on some ice blocks, the better. The other thing is that you are going to have a catheter in, you will have a drip in, and some of your medication is administered through the drip, and especially your pain medication. And just remember, you had an operation, so take your pain medication. Your arm might be better, but where the operation was, that can be quite painful. So take your pain medication. We want you to be as comfortable as possible. It makes movement just so much easier. Then there will be some drainage coming out of the wound. The other thing that you will notice, and that you should notice, is that you should have calf compressions on, which means it's something that is around your calf and that it has a pump effect. So you're going to feel like it feels like something is squeezing your calf gently and then releasing. That's very important. It helps your circulation while we're trying to recover in ICU. If it is not there or you don't feel it, please notify the nursing staff. It should be there, and it is very important. So they must put it on, and you must feel that compressions are painful. It's not a hard compression, but it is a quite firm compression. Most patients find that very comfortable, and it's like a massage. So yes, the other thing is that you do not have to lie still. Nothing is going to happen to the spacer, or the wound won't open. So I would prefer you to be as comfortable as possible. If that means sitting up, turning on your side, you can do that. There, you will not wear a neck brace because we want movement in the neck. It is the movement that will help stimulate that bone growth. So you can move your neck, just do not force it. So we have a slow, gentle movement of the neck, and as far as it is not painful. But if you cannot sleep on your back, you can turn on your side and you can sleep on your side. So whatever is comfortable, you can move your legs, although they have the calf compressions on. There's no restriction on moving your legs, and also there's no restriction on movement in bed. The next day after your operation, I will come, or one of my colleagues, and we will get you up and we will start walking. And you're going to find that from there on, things goes much easier and much quicker. It is also important to note that a lot of patients, and I would say about 85% of patients, have, after the operation, some pain in the shoulder blade. It's well documented in scientific articles, and the reason being, it is the fact that the posture of the neck was corrected by the spacer. So as we lose height of the disc and the vertebrae comes closer together, there's some compression on the facet joint. When you correct it, and that distraction on the facet joint can cause the muscle in the shoulder blade to go into spasm. It's well documented. So the best thing, if you have a beanbag at home or a warm water bottle, you can bring it to the hospital, and then you can just ask the nursing staff to maybe heat it up for you, and then just lie against it. The heat will help, but also pain medication will help. So make sure that you do take your pain medication. The time to be brave will come later again. So I hope this video helps and give you some indication of what to expect, and we're looking forward to see you.